right, we're back. Thank you to the couple people that actually watch us.
It's a few.
That's a few. There's a few people that watch us.
Do you get more
Sad
downloads?
and lonely. But
Yeah, we're getting some more traction. I would say that our recent uptick in traction has been a lot to do with the collaborations done with meme pages, strictly based on the amount of hate
yeah,
and triggered people that are reading these dumb internet pictures and taking it incredibly personal. But yeah, I'll take what I can get.
Yeah, but I think that the majority of the people that are following those memes are probably get it, but there are a select few that should read context, or at least maybe not take it so literally. But
Correct. Dude,
what can you do?
I see you making great friends with people on there. I think it's tremendous.
yeah.
It's been a pleasure.
I have probably made more enemies on there than I have friends.
Probably.
If you throw a stone into a pack of dogs, one of them's gonna yelp. Like,
Yeah.
it's inevitable.
You know what will humble you really, really quickly is when somebody posts about you on Reddit, and you get to read the thread and how much they talk shit about you, and just like everything that you do that they like disparage and destroy, and like if they knew my family, I'm sure they would attack them too. So
Sure.
big
Oh, yeah.
shout out to Reddit, for the anonymity in there and their ability to just fucking throw hate. I love it. I do. I appreciate
Dude, it's
you
great.
guys. Thank you for your support and
Yeah.
for driving the fucking algorithm. Sorry, I didn't know. Can I cuss?
Yeah.
I think there's a pause in the storm.
No, you're good.
We're good.
Yeah, man, it's a little choppy with the rain, but we're good, man. We get it. So yeah, man. First off, I showed my partner all of the tremendous comments just from the simple things that we posted. Things like, "Hey guys, maybe you should work on your interventions, your skill set, and things like that while you're moving to a hospital versus sitting on scene for 20, 30 minutes to do this stuff." And that was kind of the whole premise. The first thing that we did together, the arguments that I was seeing, they're like, yeah, but if you have to hang, mag and do a breathing treatment and start an IV and all of this stuff. And they're like, and your transport time is only 10 minutes. And I'm like, yeah. I understand. I understand your argument, but I was telling my partner, I'm like, everything you've said, none of those interventions require your truck to be in park. I'm like, those are all mobile skills. You're not intubating someone. Like, it's not like you're doing a surgical crike. Yeah. Like, I understand there's nuances to everything. If this was a simple like joke as, hey, you have an asthma patient, throw a breathing treatment on them, get them to the truck, and then do the other things that you got to do while you're moving. Yeah. I'm like, don't sit around and fuck around on scene for 30 minutes. Whether or not you have a 5-minute, 10-minute, 30-minute transport to a hospital, you can get all that stuff done, man. And like, people can argue whatever they want. But I mean, I've done it for 12 years. Like I know what I can do, and I've done all of that moving down the road. Like, and then the whole thing, God, I got so many messages when I made the comment about us not being definitive care. Dude, the misspelled hate, the over the top response to that. I'm like, guys, a breathing treatment and 2 grams of mag is not definitive care for a status asthmaticus, and they're like, yeah, but what if you have to intubate and do all this other stuff? And I'm like, I understand that, but you're moving the goalposts, and now you're talking about a peri arrest. You're talking about someone who is going to code on you. Get your shit together, and if you have to stop to intubate them, stop on the side of the road and intubate them and keep moving. They don't land a helicopter when shit goes wrong in the helicopter. I mean, I understand like you're going to be doing a lot of your shit before you get moving because you can't move around in it, but like the world doesn't stop, like keeps moving. And I would say I have appreciated your take in kindly responding to people.
Yeah, I think I have learned over the past few years that there is no room on the internet, and especially medical like EMS, phone, social media, for you to be nice. Everybody wants you to be tactful. Like they'll send me DMs or like, I really like your page, but you're an asshole. And you know, you need to do better if you really want to engage with people and have people respect what you're trying to do. I would, recommend that you come at this differently. And I'm like, then run your own page. I'm just being the way that I am because I know that if I go at it like with any ounce of gray area in my response, now there's always gray area, but if I don't come at it with this like very strong approach, people are just going to try to walk all over your argument. You have to be like nails in the fucking board when you go into an argument like that, and you got to be firm with your information. But I think everybody thinks I rely on EBM. And if that were the case, I mean, if I were to rely solely on EBM, I could argue both sides of the coin and still be right.
Yeah. Correct.
What we need to really understand is EBM is great, and I like this plug here, and the alert medic guys think it's funny, but we have to be more pragmatic about what we're doing. Correct. You know, and I get it. You want to be definitive care because you stuck a tube down someone's throat, right? You know, but we all know that typically, even those asthmatics who you do tube, or even the ones that you don't tube, but you get better, they're probably staying overnight in the hospital anyway. Their definitive care is a chest x-ray. So if you don't have a chest x-ray, I don't understand how you even think for a moment you're definitive care for an asthmatic.
A lot of that is a lot of it's a lack of experience and knowledge in the actual hospital setting. Like we haul ass, we do all this cool shit, and it looks cool and it looks fancy, and then we drop them off, and we've had them for, people can argue, we've had them for on scene and transport time, 20 minutes, 30 minutes, an hour and 15 minutes and all that stuff, and that's cool, but like if you're really doing that much work on a patient, that even like your longest time is maybe a quarter of even their ER stay, and that doesn't include their admission, going up to the pulmonary floor. You're not a pulmonologist, like you don't have a long extensive care track record with these people, and like if you can fix a person with a breathing treatment and call that definitive care, but then argue that they were too sick to get moving in a truck, it's kind of hard. Like
I think that really puts it in perspective.
Go ahead. I'm sorry, I didn't mean to step on.
No, you're good.
You're good.
And what you said, that really does put it in perspective. Like, if the amount of medical intervention they need is going to completely reverse their problem, and then they're good, they're ready to go back home, then that should be manageable while moving.
Yeah, that should be manageable while moving. And then one person I saw, and I mean, it's scary. I didn't further that conversation with him, but he was talking about how he likes to do interventions on scene, and he called it a treatment on scene, like a treat in place. And I'm like, dude, that's called a refusal. That's not a treat in place. You're not a community paramedic. You're not consulting with a physician. Like, you're not drawing point of care. You're not doing any of that stuff. Like, that's not a quote unquote treat in place. Like,
So,
that is
so
not.
what's your? We're
Like,
breaking up for
that is a
real
slippery
second
slope
here,
to go
but
down, thinking that you can
What?
treat in place stuff and then be like, I fixed them. Like I understand, like, you know, diabetics, you know, you can give them like a little bump of sugar, blah blah blah. But again, it always goes back to recommending transport up to the hospital. You did have some sort of medical emergency that required an intervention. You're a paramedic. You did not wholly fix them that you can 100% guarantee. Like you don't know what's going on, you know, with.
What's the threshold, though? What's our time threshold that we should be on scene? And so I just want to set one kind of like people are gonna always get upset about this, but if we spend 30 minutes on scene to work a cardiac arrest, I would imagine that should be the extent of the time that we're spending on scene, unless there's an extrication that is super complicated. I can't think of a single reason why we would need to be on scene for more than 30 minutes. So now, can we work our way back from there with all the runs? How long does a run normally take at the house before you take off to the hospital?
Yeah. I mean, for me personally,
did you guys get,
like for me, I mean, obviously there's, it broke up a little bit, but we got it.
Okay.
So like, I mean, like me personally, like, dude, obviously there's housing logistics, you know, apartments, you know, getting a person out, you know, stair chairs, moving, all that other shit. Got it. Understood. But like, do your assessment, grab your vitals. If they're having, you know, crushing chest pain, obviously you're going to run your, you know, your EKG. But I'm like, an assessment, vitals, and an EKG, that's 7 minutes.
Yeah,
and that's not moving quick.
The problem with these chronically sick or these acutely sick people that, you know, stay and treat on scene, they don't need a paramedic. Anything we're going to do is not going to resolve their issue. They need that crushing chest pain. They need a cardiologist. They need a cath lab. Those trauma patients, they don't need a tourniquet. They need a surgeon. And it's just it's annoying when you get on scene and someone just wants to sit there and dick around because they have that scope of practice and they just want to stay and play. And it's like, no, do what's best for your patient. Get them to the damn hospital.
You guys there?
Yep. Yeah.
It cuts off, so I never know. Yeah, I mean, what it boils down to is this. The way that we're currently reimbursed is to not treat on scene, right? And people are going to argue that, well, then what are you trying to say? You're all for big, you know, expanding the scope of practice and for degrees and for all that. But that's not how it works right now. So we have to do that first. So right now, when you're on scene, all you're doing is wasting time. Now, I know there's going to be arguments for like, okay, you could do this, that, and the other. Yeah, we're talking about the nuances of how long you should be on scene. And obviously, at this point in EMS's, I don't know, place in medicine, we're not reimbursing for treatment on scene. And these patients are either going to go to the hospital or they're not. And if they are going to go to the hospital, then you should be, like you said, getting a set of vitals, doing your assessment, doing the basics to stabilize them, get them on the truck, and get them to the hospital. If we want to be treating in place, then we need to be looking for ways to get reimbursed for those treatments.
Yeah, that's a different branch of medicine. And, you know, there's a lot of places trying to push for that community paramedicine where you do treat at home, but that's not what we do. Like, and the cliche, like, oh, you're just an ambulance driver, is many people in this career that hate that. At the end of the day, that's what you are. You're a medical taxi. Your job is to pick someone up from the scene. And it's literally how we're paid.
Literally how we're paid.
Yeah, my paycheck is for driving people to hospitals.
Yeah. And so I've been around agencies. So twofold to that. I've been around agencies that do have active community paramedics, and the scope of practice obviously far greater. It's, obviously it's critical care, but then they have an even further scope dealing with labs, being able to draw labs, point of care, telemetry and everything like that. And then I know that they've called these community medics out, and they're there with them for hours. Like, it is a long term thing. Like, even, and that's still even, like, they don't have an x-ray. They're not shooting chest x-rays. They're not doing CTs. They're not doing any of that stuff. And they're still out there for hours.
Any of that stuff, they have to call a truck to come get them.
They still have to call the truck back out to come get them.
Are they reimbursing for the treatment in place, or is this recoup on hospital?
Yeah. So what happens? Yeah, what happens with what's happening with that agency? If they come out and the community paramedic takes over care, and they consult, I'm not going to air them out like the hospital, but they consult with that hospital's medical director that's on shift that day. They're like, hey, this is what we have. It's I know of one when they went out on an asthmatic, started a breathing treatment. They sit there, it's a whole hour long breathing treatment. They run through that, and then labs before and after, and then all of that is actually billed as essentially a out of hospital payment. So they don't get charged for the actual transport, but they are getting charged for, the agency is charging them for like an out of hospital thing, which is great. It is cool. Yeah. It alleviates up, in the grand scheme of things, it's one bedroom, one room in an ER, but it alleviates, some stress of having to have another person in there that you can hopefully keep at home. But yeah, I mean, it's a long-term process, like the whole quote unquote treat in place type thing. That's, it's not
So I have a
20,
question.
30 minutes. Yeah.
There's a question. I was thinking about this, and it kind of plays both sides of this right here. Let's just say that the medics who argue for treating in place, right? And I'm not talking about community paramedicine treating in place. I'm talking about 911 responders who are giving treatments, and they're sitting there for extended periods of time and giving MAG and doing all these things on scene to get their patient completely back to normal, so that they're not. What did one person say? So that we're not overwhelming the already burdened ED and ICUs.
Yeah.
Okay. So I thought that was a poor argument, but it did make sense. Like, you can look at, there is some logic to it, but I thought it was a poor argument like this, because at what point, so when you think about what you're doing, right, are you going to SOR that patient at the end of your care? Like, are they going to really AMA? Or, because once they AMA, then there's really no reimbursement whatsoever. So actually what you're doing is you're causing more of a problem. And probably they're still going to go to the ED just later that day.
Yeah. So that whole argument with not overburdening the ER, there's this misconception through all of emergency medicine that it's somehow our fault or the patient's fault. But the reality is, like, if someone has an acute issue they want to address, or even a minor chronic issue, and they go to a walk-in clinic, they're going to be charged massively out of pocket by their insurance. But if they go to the ER, a lot of times it's covered, a significant amount of it is covered, and they have a significantly smaller copay and out of pocket. So people are incentivized to go to the ER. And if your service is already stressed by your call volume, and you have these people with chronic conditions calling, and you're treating them on scene, not only is your company not getting reimbursement, but you're also you're encouraging people to call ambulances as mobile walk-in clinics and to treat in place, and that's not the solution.
Yeah. The
So it goes back
this
to saying people want to be doctors without being doctors. They want the title of doctor.
Correct.
Yeah.
They don't want to actually go through the work of being a doctor. So big shout out to doctors, but medics deserve something too. It's just you chose to be a medic, not a physician. So if you want to do definitive care, either you need to up your game or, figure out.
You can go
that
be
maybe
an
this is not
ICU
the
tech.
job.
yeah.
If you want to participate in the definitive care, and if any of these people are arguing to stay on scene and do this care, they should go work in an ER. They should go work on an ICU floor as a paramedic tech and see what definitive care actually look like. Because I've worked in the
It's a
ER,
lot
and
different, I think,
what we do
what people
is
think.
yeah, and we're giving 2 grams of mag, which is nothing. You get these people who are their electrolytes are out of balance, or they're acutely dry and they need fluids. You can't just load them up with fluids. You're gonna further their acute kidney injuries. You need to be doing I's and O's. You need to be doing UAs. You need to figure out what's going on with them. It's so sitting on scene and starting a 20.
Well, aren't there issues with mag and like potassium? Like if you don't have enough potassium, your mag's not going to hold on anyway. So like at some level, you're just not, you don't have the resources on the truck to even provide the care that most of these people are going to need in order. Even ED patients, strictly not admitting patients, they're going to need probably more than what you can do. Unless, like you said, you're willing to spend the next 12 hours with them in bedside.
Yeah.
Yeah.
You don't have a potassium buffer. Like your potassium just runs straight through. So you have to have potassium every day. So a lot of these people, they're getting IV potassium, they're getting PO potassium that's extended release. So, we can't do that. Plus, we're not going to be giving potassium on the trucks anyway. It's so cardiotoxic if you don't administer it correctly. And, I've been in the field. My knowledge is limited because I'm just a paramedic. It's basically our protocol book and the stuff that I'm willing to pursue, but I don't want to be giving potassium to a patient. It's dangerous.
Yeah.
Bro, they're running, if they're giving potassium, they're running multiple lab sets. I mean, this is not just, you know what I mean? Like you said, it's not so simple as to say that, well, listen, as a paramedic, I've seen this a few times, and so this is what I would recommend we do. We're going to give you a bag of K, just to make sure that everything is good. Then we're going to throw some mag in there. And we're also going to do a couple treatments on the heart, whatever. Be realistic for a second. Like, you guys just don't have the resources like that. And if you want to be a nurse, go work in the hospital.
Yeah.
That's like nurse-driven care, right? That's what they do.
Yeah, exactly.
Yeah. I was working in the ER, and I had a patient that had a potassium drip, and I couldn't find a pump, so I went and got a dial-a-flow, and, I've calculated lots of drips, so I calculated the drip and I started on the dial-a-flow, and the nurse came in, and dude, you would have thought I was holding a pillow over the patient's face. They lost it. They were like, absolutely not. You cannot give potassium without a pump. It's hospital policy.
Yeah.
Or the guardrails, and basically it's like
they have to have the nurse help.
Yeah,
they have to have the nurse button within reach.
Yeah.
And that's the one thing too, is that everyone's like, well, I saw someone message
and
me.
on telemetry, right?
Yeah.
Oh yeah. Any cardiac active drugs, you have to be on telemetry.
Yeah.
That's right.
But obviously I don't know how your agency works as far as assets go, but we were talking about it, like we work in a very, very wealthy county, and the county has essentially unlimited resources. We have blood, we have vents. We have RSI, we have, just about anything that a paramedic can do on a national standard, we have access to.
And we push the standard. Like we're constantly trying to be a model for EMS. So our agency's always pushing the state. Not yet.
That we're not pushing.
Yeah.
that we are not pushing body cams.
Yeah, that's a lot of work. All that HIPAA stuff.
Yeah. But as far as treatment goes,
Shit, they can't get us to carry radios.
Yeah, they can,
much less a
they
body
can barely get me on the radio, let alone a body cam.
Yeah.
Good luck.
It's always going to be charging.
Yeah.
Right. Yeah. Yeah. I think.
But
Yeah.
yeah.
But yeah. So anyway, you're progressive as hell, and you guys have a lot of stuff going. I think. How much of it are you using?
Dude, not. I mean, we use it, but like.
How many
I mean,
RSIs are you doing
So
annually?
everything not a lot.
Yeah, I mean,
So
our call volume's low. It's not. It's definitely below the national norm.
yeah. Our busiest truck is going to maybe run 7 calls, but every other truck is going to be averaging like 2.
Yeah,
One or 2 calls.
We run a pretty. But to be fair, we also have an insane amount of trucks. That's the difference.
We do.
Is we have
12 or 24.
honestly. We work 24/72.
Oh, okay. Yeah, that's a nice schedule.
Yeah.
So we'll put it in comparison. We usually run about 70 calls a day.
No, our
60.
last one was like 50.
Yeah.
50 is like a typical day.
Yeah. And we have, we're about to put our 19th truck in service in the next couple months.
And that'll be 17 24-hour trucks and 2 12-hour trucks.
Yeah. And that being said, obviously everyone's going to be like, well, you don't know because you haven't run calls. I'm like, dude, I worked in Detroit. Like I worked in Pinellas County. Like we were doing 18,000 plus transports a month. Like you don't need to tell me what busy is. Like that's where like I cut my teeth getting my face beat in. I'm like, I'm just here because it's a retirement service. Like I know what busy is. Like
Yeah,
And I think a lot of people
service,
think that because you don't work in a busy service currently, that you don't know what it's like. I think the fair trade-off here is that people should spend a little bit of time in each type of service so that they know what every kind. What I mean by service is like I think you should work in a rural. I think you should have experience in a really heavy, city, and then some suburban or flight or just. Just mix it in and get yourself kind of well-rounded there, and you'll know. But you don't have to work in a system for 50 years running 30 calls a day. You would commit suicide by the time you were 30. I mean, it's just not. It's not sustainable to your body.
Yeah.
Yeah, there's a big difference. I worked rural for a while, and when you have like a 30-minute arrival time, and then you have like an hour plus transport time. And then, there's the inverse working in the city, or I did my ride-alongs in the city, and you're running like 15 calls in 12 hours, and your turnarounds are like 20 minutes. Like from Tones to back on the street is like 20 minutes. It's here. We're
spoiled.
Yeah. The demographic in this area, the socioeconomic.
Yeah.
Yeah. For sure. I'm stuck here. Like I don't want to do anything else. It's so cushy.
Mm-hmm.
It's cushy until it's boring. That's the way I look at these things.
Correct.
Like I'm like, this is a great job, man. I'm never going anywhere else. They're paying me $50 an hour to do this. And then within a year, I'm like, this shit is boring as hell. I hate this job. I need to do something. And then I start finding side gigs.
Yeah. We get that a lot with the new hires and stuff like that. They'll come in, especially the green ones. Ink's still wet. Yeah. They'll come in, and this is their first job, and they're like, "Oh, this is gonna be good." Yeah. And then we'll get like one or two things, be like, "This is too slow. I can't be here." And I'm like, "I don't disagree with you, man. Like you're brand new and you're running 3 calls a day. Like you haven't had." Enough shit. Like you haven't been put in the situations enough, and it's not going to come around enough in this area. And then you have the other people that come from a busy place, and we run into this a lot. They'll come here from a busy place, and then they're like, I ran 20 transports, 22 transports in a shift, and like I'm gonna love it here. You guys are, super slow. Like I'm looking forward to it, and then you know, 6 months later, they're like bitching and complaining because they're like, oh my God, I ran 6 calls today.
Yeah, I got up once in the middle of the night.
I'm like,
I napped
Or
all
not.
day and got up once at 11.
yeah, yeah. So
It's,
yeah, we run into that, but
I would have had a job interview today, but I changed it so I could meet with you guys. But
oh yeah,
Aw.
and then,
I-
then we left you hanging.
Yeah, and I was late. Dude, I'm such a piece of shit.
hey, listen, it's all good. I don't hold grudges unless you're the cheesecake dude.
Oh, dude,
But outside
that guy
of
loves
it,
you.
yeah, he
I was
not
like, why
anymore.
don't
I
you
don't
kiss him
think.
on the mouth already? God,
Yeah, I
think he gave
stay away
up.
from all the social media stuff.
dude, he
Good for
he
you,
had
dude.
it out
Good for you. Fucking do it. Stay away from social media. It's horrible.
Yeah.
Don't follow me
I
on
have an
Instagram,
Instagram.
either.
Yeah, I just
Not
have
you.
Instagram.
You can
is
follow
for
me.
jujitsu. I sure. Mine's for jujitsu and mushrooms because when I'm not at work, those are the two things I like to do. Not
What
psychedelic
kind of
mushrooms.
mushrooms?
Forage for mushrooms.
yeah, the good
Say,
kind.
all right.
That's an off-air topic.
I went morel foraging the other day and I found a bunch of morels. I know.
I'm in Indiana. You know they love that shit here.
Yeah,
Yeah. Oh yeah. This whole area, like, and you
Brown.
got pawpaws up there. Yeah, I'm all about it.
We do have pawpaws.
He wants me to move.
Well,
to
they're coming
Florida.
back.
He's like,
yeah.
yeah.
Pawpaws are the Indiana fruit, right? Like the Indiana banana or some bullshit like that. I'm from Indiana. I don't
Yeah,
even know.
they have names like that all over the place.
I like that.
Yeah,
That's
I'm the Indiana banana.
that's gonna be my stripper name. Dude,
I like that name.
that's
Like
my
Indiana
stripper
Jones.
name.
Indiana
I'm gonna
banana.
be the Indiana banana. I'd be like, that's a plantain, sir.
You're not the Florida
You want to
gator.
answer? You want me to go on my Instagram on the Pragmed one and pull up a couple comments we can respond to?
Dude, let's do it. I would love
Sure.
to.
Yeah, we can
Let me
break
see
it
what
down.
I can find. There's always some good ones. So here,
The
just
one
hear
thing-
me out for a second, though. Go ahead.
No, I was gonna say the one thing I would love to hear in an ideal world, as far as scope of practice goes, in the 911 setting, because dude, people love you, and I love reading. You're one of my favorite newfound pages. I love it. It's so much fun.
I saw like 170 comments. I was like, that's too much reading for
That's
me.
a lot of shit
I
thrown.
don't,
Sorry.
I don't have.
But in an
Yeah.
in
Patience is hard.
an ideal world, yeah, if you could add something to the scope of practice, which I know everyone critiques you for saying, you know, just get them to the hospital shit, and that's literally not the context of it is not what is being intended. What scope of practice, like what skills do you think that a 911 paramedic could or should be able to do in the field that would assist, that would help further patient care that we could do?
I already know my answer, but if you
You want to go first?
go ahead, if you got something.
I mean, so I don't know how we're defining scope of practice. I think maybe if we're talking about like tools to the toolkit,
Yeah.
I could probably give
Yeah.
a better answer. Scope of practice, I think, would depend on like where you live, kind of, if that makes sense
Yeah.
for me.
What about tools? Because mine's a tool.
Yeah, go. I'll do mine. I don't mind. And I think I may catch a lot of
yeah.
flack for this, but I who have been fortunate enough to work in a hospital setting for an extended period of time and had access to ultrasounds, I would argue that the ultrasound, utilizing it for point of care, especially things like IV starts, which I know if you've ever even like followed up the page within the past month, we did a big thing with this guy, Dennis, on Instagram, the vascular guy, and essentially where I'm going with this is, I know that IV starts by EMS providers are bad. I know you guys think that you're great at them. I used to too. I wasn't good at them. I thought I was.
Go.
But
go
I only
shadow,
started
a pep team.
IVs in the AC and hand.
Yeah.
Yeah.
Yes, That's what my interview is for tomorrow.
The Pictine? Yeah, I thought I was a badass IV starter.
Yeah,
And when I
well,
work in
it's
the
the
ER, people
vascular
are like,
access
hey,
team. But yeah.
yeah, those guys are ridiculous. Those guys and ladies. Yeah, I thought I could start an IV
Yeah,
on
yes.
anybody. And then you get these patients and they come in there and they're dropping IVs. And it's like,
Where the fuck did you find that?
they just know the vascular anatomy so well
Yeah.
that they can just
Yeah.
stick a needle in someone and get
Yeah.
an IV. It's incredible.
And so, with the part that it seems, the reason that I like it so much is that it takes just a couple extra minutes, maybe not an extra minute if you have like a butterfly handheld one. But what I really like about it is you can start an IV that's not in the AC that, if used, if we're starting them appropriately, if used, could potentially last a patient 2 or 3 days, or longer. But what I see in the hospital is the IVs placed by medics on the left side primarily fall out or pulled out, depending on the hospital. But realistically, they're coming out or they're not working, even when the patient is just getting to the floor. The very first thing the nurse will ask me is, Aaron, can you please come replace the IV from EMS? It's not working. And the patient hasn't even been in the hospital for 12 hours.
Well, that's because
And then we
EMS
put them
is
in
just
with an
so
ultrasound,
desperate.
and they last 5 days.
Yeah.
Yeah. I mean, you get people, they're like,
Yeah.
I'm gonna get an IV no matter what, and they're starting a 24 gauge in someone's thumb, and it's like, why? Why did you do that?
Yeah,
It's
waste of fucking time.
Yeah.
Yeah.
It's a waste of resources, time, and you're endangering the patient. You're gonna open up a spot for potential infection, and it's just unnecessary.
It is. And can I respond to a comment about a guy who said, this guy said to me, he said about this very topic, he goes, what was his rationale? The chance of someone being injured by an IV is so small that it's nearly impossible. And I just wanted to be like, dude,
Bullshit.
there's a whole world beyond EMS that you need to, there's actual medical evidence that supports things way beyond just pre-hospital care. No, the IV is not completely benign. 100% not. Like, just look up CLABSI scores and look up, infection. Like, some units won't even, some units, depending on how low their scores are, will not, or hospitals even, will not give their employees a pay raise if their scores are low. And that may not even be something you'd cause. So now you're causing nurses to get paid less. Thank you very much.
Yeah.
And that's a real fucking mistake.
Yeah. There's so many misconceptions about starting IVs. Like the incidence of phlebitis is high with inappropriate IV access. And, a lot of paramedics, we start an IV and we just tape that shit down. And if you get these old women or old men or women, and you just tape an IV down like that, and it's there for 6, 8, 10 hours before it's addressed, you can give them a pressure injury. If you're using like chlorhexidine,
Coban too.
we had an in-service about starting IVs, and they're like, this is how you have to use chlorhexidine, because if you don't use it properly and let it dry completely, you're going to cause chemical burns. Like, the incidence for injury with starting IVs is there. And if you just say it's impossible, then you're going to be the one that's going to be causing the injuries.
Yeah, the one thing,
Probably already have caused
this is
injury.
yeah. The thing is, and the one thing too, and I'll say, I'm not the best at it. I catch myself a lot.
What, not wearing gloves when starting IVs?
No, though, is the in EMS, it's so when you're going to start your IV, right? And even if you set up for it, you have your extension, and even if you got a fluid bag and all that other stuff, everyone takes the cap off the extension and throws it on the bench seat. I'm like, would you lick that bench seat right now?
Yeah,
Fucking absolutely not. I guarantee you won't.
I would.
Like I would. I'm a
know,
I'm a
you're-
terrible
you're
person.
disgusting.
But I mean,
You drop
that
food on the ambulance floor, and you're like, that pepperoni is fine.
dude, Mississippi. It wasn't even 2 Mississippis.
Yeah.
But then you got that, and then like you got your extension on there. All right, you're gonna go hang a fluid bag. Cool, perfect. Did you alcohol?
Did you clean the hub?
Did you clean the hub? Was your extension? Was your IV bag swinging around with the cap off? I'm like, you just grabbed MRSA from every orifice of this truck, and you're pumping it into them now.
One of our really good paramedics, one of my favorite guys at the service, he relieved me last shift, and he came in. He had the little alcohol caps for the pigtails.
Oh, the green
IV
cap,
extensions.
yellow, orange cap.
Yeah, and I saw him carrying those around. And I was like, man, that's, you know, I wouldn't do it because I'm lazy, but that's awesome that he's doing that.
So when on our show, when we had the vascular guy, he said, I asked about those, and he said, yeah, they're pretty good, but he would still wipe down the hub even if you're using one of those.
Yeah.
But it's 100%.
Well,
I shouldn't use using a statistic, but just point it. It's better than nothing, right? Like it has to be better than nothing.
Well, alcohol is a mechanical cleanser as well, which you know, no one ever told me through my entire schooling. Like, if you don't scrub with alcohol, it doesn't do anything. You can't just pour alcohol on something and it's sterilized.
Yeah.
Oh yeah, 30 seconds. You're supposed to wipe the area, the site for 30 seconds. And it's what do they call it now? Cross hatching, you know, like this
Yeah.
and then this. And Dennis, the guy from the vascular guy, says count to 30 one day and see if you're actually doing it for 30 seconds.
Yeah.
And you'll be shocked.
Like brushing your teeth for 2 minutes.
Yeah.
Yeah. We don't brush our teeth in Indiana, but I know what
man.
you mean.
You know, you don't have to. Y'all got enough of that rolled tobacco. Chew on that. That cleans your teeth real good.
I haven't touched tobacco in a long time.
It's good. It's bad for
So-
you.
It's terrible.
Nicotine's
So you want me-
bad for you.
Nicotine's fine.
Yeah.
Nicotine's fine. There's nothing on
What's
this can
not?
that says that it doesn't cause
What's
cancer.
that warning right there say?
It says it's addictive.
Yeah.
That's all it says.
What kind
So
of
am
what
I.
is it?
Oh, it's those Zen pouches.
Oh, Zen. Oh, you like Zen?
Yeah, I'm that
Are
guy.
they good?
Oh,
But are they good?
I mean, I've got a pretty low standard on
Oh,
everything.
do you want me
in
to
life.
plug? I'm plugging these hats that I keep making.
Dude, I saw the military camo one.
Those surgical caps? Mm-hmm. Those are nice.
Yeah, but look, it's got the camo on this.
Dude,
That's
I
cool.
like it.
I don't know what I'm gonna do with it. Yeah, one day I'll sell them to somebody.
Yeah.
Dude, I saw
And I
him
did
the
wear
other
something
day.
Canadian for you.
Dude,
Where-
I told him he had to wear a Canadian tuxedo on the show. And he
I
he told
love
me to go
Canada.
fuck myself.
Yeah. My dad gave me the opportunity when I graduated
I did.
to pay for prom or to go backpacking through Canada for a couple of weeks. And I was like, fucking Canada. High school people suck.
Yeah,
Yeah, why would you want to go to prom?
gross.
Yeah, it's terrible.
I mean, I suppose if you're like, if you had a girlfriend that you were like waiting to like consecrate the moment, but other than that,
you say
I guess
desecrate?
Desecrate her, yes, yeah.
Yeah.
And then 20 years down the road, you look at her and she's a three, you know, she's a big and you wasted all that money when you could have gone backpacking in Canada. Where in Canada?
So I flew into Buffalo, New York, and then I took the train across the border to Niagara. I stayed on the Canadian side for a couple days, and then took the train up to Montreal for like 3 or 4 days. Went to Quebec for like I think 5 days. Came back to Montreal for a couple days, and then back into Buffalo. But it was great. It was a great experience. French Canada's nice.
How much did you spend?
I don't know. My dad paid for it. I was very
Like,
privileged.
so did he just like give you a credit card and was like, just go do whatever?
No, he got it was mostly I stayed in hostels. So
Oh, okay.
I don't remember if he gave me a credit card or if I had cash. But yeah, most of it was just like staying in hostels and just roaming around the city for a while. It was fun. I really enjoyed it.
Do you well, how old are you now?
31. I'll be 32 this year. And I did that when I was 18.
Yeah, man. Do you remember that time? Remember the time when you were young like that?
I remember being
Still like
31.
Dude, which
When I was 31,
which,
I hadn't quite figured out what to not drink.
yeah.
Yeah.
Yeah, exactly. Which Bush president was in office when you were 31?
It wasn't Bush. It was wait, who was it? It would have been Obama.
It was Obama.
It would have been Obama.
Okay.
Well, it's not a terrible time to be
Yeah,
alive.
I was in high school when he got elected for the second time. Right?
When I
Was
joined
he? Yeah.
when I joined the Navy, Clinton was the president.
Okay. Nice. Dude, so you're
Yeah,
like
so-
you're
yeah,
like the
that was,
Kosovo era.
Yeah, except I stayed in for 13 years.
Ooh.
So
So-
I got out in 2010.
Yeah.
So all the eras, except for this post squad era or whatever it is. I don't know anything about all that.
Yeah.
I need to get like a fucking quad, like one of those hats, you know, like these.
Yep.
I have one somewhere. You know what I'm talking about? They're like the really cheesy military hats that all the
Yep.
old 90-year-old veterans wear.
Yeah, dude.
I need
What's
to
it
get
called?
one of those.
G-Watts. Watts.
They're like,
G-Watt?
yeah, the G-Watt, but like a G-Watt hat, like the old. I have one somewhere around here. I just don't know where the fuck it is. Sorry, guys.
I'm assuming it's not
But you
the
know what I'm talking
G-Unit
about.
hat?
Yeah.
I have one
Yeah,
of
it's not
those
the
too,
G-Unit
Young
hat.
Buck. He's from Nashville. Isn't he from
He
Nashville?
is actually. When I was real young, like 15, we went we were down that way, went to Opry Mills, and we saw Young Buck, and then there was a shooting. So very Nashville experience.
Yeah.
Did he cause it?
I think it was,
was 50 there.
because he was there. Yeah,
That's funny.
I was going to visit the Lego store.
Oh, here it is. Here it is. Here it is. Can you see my phone when I turn it around, or is it too
Yeah.
far from you guys?
Yeah, we can see it.
All right, hold on.
Yep.
Okay, yeah.
Dude, yeah, like you're like
one of those.
like the Vietnam, Korean War
Oh yeah,
era hats.
Those are awesome.
Dude, those are my favorite hats.
I see those and I think, oh, you know what? That's-
Dude, there was this. I parked really shitty one time. I was super early in the morning at Home Depot, and I was pretty close to the line. I'm like, ah, fuck it, I'm not near anyone. And this guy came over. He wasn't even parked next to me. He goes, "You need to straighten your car out." And I'm like, "Okay." And I'm looking at him. He's got one of those hats on, and it was Vietnam Special Forces. And I'm like, all right, I'll straighten my car out.
yeah.
I'm not trying to fight you.
Yeah. You have to make a decision. Yeah.
Yeah.
You need to make a
Yeah, I'm
very
like-
quick decision on.
Yeah. Yeah, I don't
They're
care if
getting
you're
old
80.
now.
Yeah.
You
I
might
was
be
like,
able
it
to
doesn't,
take
it doesn't,
some of the World War II guys.
yeah.
yeah,
Yeah.
yeah,
They're in their 90s. I think I got them.
yeah. They might.
Yeah, I
still
think
They'll still
they're
fuck
basically
me
like
up.
Mima's dad. That's how old they are now.
Mm-hmm.
So
Yeah.
definitely could whoop on one of them. And even a lot of the Vietnam guys are getting super old these days.
Yeah.
yeah.
Because
They'll
if-
still-
if the
They'll
if,
they'll fight your
if
ass.
the Gulf War era guys, oh, they'll fight you. But that's just because they're nuts. They're not
Yeah.
fighting
Yeah.
you because they can't or because they are good at it. They're fighting you because they've lost complete control of their mental cognition.
They want
they're
nothing
just
more
awful.
than heroin and Vietnamese prostitutes.
Yeah.
They miss it.
Yeah. You know when you go to the dementia wing and you pick someone up and they start hurling Asian slurs at you with a Vietnam era hat, you're like, all right, this is not the This is not the tree I'm trying to bark up right now.
Yeah.
Be like, listen, I'm trying to get you
Try
away
to-
from him.
dude,
Let's go. Get
I
in the
try to
truck. Let's
avoid
go.
Those are the trees. I love
know.
barking up those trees.
No.
Yeah, this guy's literally been driving. He's like, Andrew,
are
shut
so
the fuck up. And I'm like, no, dude, this is going so
Yeah.
well.
Damn.
Well,
dude,
I don't mind having. Go ahead.
I was gonna say, man, dude, I appreciate the opportunity to talk to you.
Yeah.
Oh, dude, I am the one that should be honored. I don't get invited onto too many podcasts. A lot of times they try to kick me off my own.
Yeah.
So people, it really doesn't matter anymore because I don't have a lot to lose. I never did. I just learned that as you get older, it doesn't really matter what people think about you.
It doesn't.
Yeah.
Because-
it doesn't.
Yeah.
Right.
Hateful comments. I'm here for.
Yeah. All
brother.
comments are good
I was
comments.
gonna-
Just don't read them.
Yeah, I mean, I can't read them all anymore. Ever since this, I have a post. I guess we got lucky with it. Kind of went. I don't know what viral technically is, but it went like 2 million views, and I'm still getting comments about it. But just some of the things people say are just like. Let me see if I can find some because I just want to read something fun.
Yeah, dude, read them.
Yeah.
So that you guys can be like,
I had one this morning. It was, I mean, I didn't say anything shitty back to the guy, but like, it was making a joke about, hey, the whole like pandemic thing, the avian flu in Texas, and I was like, ha ha ha, it's another reason to tell people that no, you can't ride in the front of the truck. Like, come on. They're like, but what if someone's dying and then they die alone and they can't be in the back? I'm like, listen, if there's a person legitimately circling the drain, I'm not having a family member
Yeah,
sit in the back, hold their
absolutely
hand.
not.
No.
Yeah,
I'm
I
like,
don't-
I've done that before, and then I have two patients.
Yeah. The whole thing with people riding in the ambulance, I cannot stand it.
Yeah.
It's if you need a 911 ambulance, then that person needs all of our attention.
Yeah.
Like if you think you can ride with them, if they're not a completely disabled adult that needs a primary caretaker or a child,
Yeah.
then no one else needs to ride with them.
Yeah.
They're grown-ups.
We're not escorting you back into the ER through the ambulance entrance, especially with someone incredibly critical. We're not going to escort you back. And then even if, somehow you manage to finagle your way back into the resus room with this person that's circling the drain and you've got family members there, the first thing that's going to happen is they're going to find a nurse that says, hey, remove those people from this room and take them to the meditation room.
Yep.
And as soon as we've got everything under control, we'll bring them back here.
Yeah. Sometimes control is dead.
Yeah. And I mean, like, dude, he's like, you're heartless and blah, blah, blah. And I was like, dude, I'll play. I straight up said, I was like, I'll go play Heartless from Kanye West right now as soon as I tell them that they can't ride.
Yeah.
I'm like, you follow right behind me. I'm like,
They're gonna.
statistically, you're going to get there at the exact same time that I get there.
Yeah.
Like,
can I just say that I don't always practice what I preach? I absolutely love transporting family members. I find it to be some of the best quality conversation money can buy, and I will bring them on board no matter what. So even if it's not me that's taking the run and it would be my partner, I would be like, yeah, they can ride, because I get to sit
Bring
up
'em
front
in.
with them and have like a legitimate conversation, and oftentimes they're fucking drunk already, right? Like they're pouring out a can of Coors as they're getting in, and you just get to have a really enlightening conversation where you learn a lot about people. And so, yeah, I'm going to do it every time. So that would be one thing, probably not safe to do, but
yeah.
When you find out they're 5 years younger than you and you're like, God, I thought my life was shitty, but look at you.
Dude, the last time I've ever voluntarily put a drunk person in the front seat of my truck, it was in Florida, and he started yelling into the back of the cab, like, help my friend. And I'm like, both of you guys are just drunk. I'm like, that's it. He starts yelling at the medic and then turns around and starts hitting me while I'm driving. Dude, I'm like, this is the fastest way for you to get kicked out of a truck. The fastest way, dude, right in park. And I'm like, you can get the fuck out. He's like, well, where am I? I'm like, I don't give a fuck. I'm like, you just smacked me in the side of the head. I'm like,
Yeah.
fucking get the fuck out.
Yeah.
I'm like, I don't care. I'm like, you're lucky you're not getting the cops. I'm like, get out of my truck. I'm like, never again. I'm like,
Did you kick them both
let,
out?
dude,
Like
I
two dudes, or
fucking
was it
wish,
just one?
dude.
I'm sorry. I thought it was two.
No, just the patient in the back was cool. He was just shit faced, and he's like, I'm good. It was the guy up front, and I'm like, dude, never again. I'm like, the people that ride up front, I'm like, I look at them, I'm like, are you drunk? And if you are drunk, can you kick my ass while I'm driving? I'm like, if you meet those qualifiers, like, there's a chance of you beating the shit out of me while I'm driving this truck. I'm like, nah, man, you can take an Uber down there. I'm not trying to fight again. Don't get me wrong. I'm a willing participant and volunteer. If you want to fight me, like, dude, I don't have very many hobbies, but one of them is
How many
is
times
fighting.
have you been driving with a rider, not like a student rider, but like a patient family member, and you're thinking about all the ways you might be able to fuck them up if they decide to take a swing on you?
Oh,
Well, dude, it's in Florida. That's a legit concern, man. Like, you don't know, especially where we work, man. Some of it was the fucking hood. Like, the whole, like, if you're not treating them well enough, they'll pull a fucking gun on you type shit. So, like, everyone's like, no, it's safe, blah, blah, blah. I'm like, no, bitch, it's fucking not. It's not always fucking safe. Just like, if we want to talk about nuances, like, here's my nuance. I'm like, I worked in a fucking city, in a county, in a state that, like, as soon as a child's born, they're like, well, we better get them on meth because it's Florida. So like it's fucking bananas. No, dude, no. Like, I can tell you that it was within the first 2 or 3 years, I had more than a handful of instances where the person in the front seat tried to get spicy. One was the only time where the guy hit me, but I've had numerous times where I'm like, no, like, we're stopping this right now, and like, I'll just pull the truck over, and I'm like, nah, partner needs me in the back real quick.
Go ahead. Sorry.
I was gonna say, like, no, I'll just park the truck and be like, yeah, he needs me in the back, and I'll get in the back and just call the cops on the way around, and then cops will come and escort the passenger out and all that stuff. I'm like, dude, I'm not about to fight you. I'm like, if you want to fight, it's like that whole Russian, car jujitsu where you start in the seatbelts. That's really what it's like, where you're just sitting there. You're like, all right, so I got to get the seatbelt off, and now I got to grab their seatbelt. I'm gonna put you in a loop choke, fucking choke you out.
so dumb.
Fucking cinch that up. Like,
I have never kicked somebody out of my ambulance. I have had one patient. She was post-dicto when we got her in the truck, and family was like kind of hovering around the ambulance where they wanted to like ask a million questions. She had a history of seizures, so it wasn't any kind of like new onset concern. There was no trauma. She gets in the back of the truck, and I was going to start an IV because I thought, what if she seizes again? I should probably give her some Versed or something. So
sure.
I'm getting ready to start the line, and she kind of perks up a little bit, like she's starting to come around. And, what are you doing? And I was like, I'm just going to put this IV in just so we can just make sure you're good. She was like, I don't want to go with you guys, And I'm like, okay, well, what do you want to do? She was like, I want to get the fuck out of here. And I was like, well, then get the fuck out of here, kind of, like, just,
Yeah.
I can open the door. And so I just opened the back doors, and she jumped out and ran. And that was, like, she didn't want to go.
Yeah.
And I wasn't going to be a part of that. But I feel like if she had gone with us, it could have been more problematic. Like, we probably would have been trying to restrain her in the back of the truck. And I'm not trying to hold somebody down for 5 minutes while they kick and scream when I could have just let them out, easier. But I haven't had to actually, I've only done it once where I let him out. I did one time get to catch a girl who was cuffed to the front, like the cop had her cuffed to the front. No, I lied. She was still cuffed to the back, and somehow she escaped the cop straps. And I hadn't closed the back door. We weren't en route yet. I hadn't closed the back doors, and she took off out the back of the ambulance, but didn't realize that there was a big ass step, and that she had cuffs to the back. But fortunately, I'm fucking Superman, and I grabbed her and threw her back on the cot and saved her life. So
there you go.
I'm like a hero. A lot of people consider me one.
You are, dude. I think the first time I ended up willingly not let a person go in the ambulance was I was telling the story on one of the last episodes where where the guy ended up pulling a gun on us, and we were stuck behind he was waving around a rifle out of the window from his apartment, and then of course I'm the fucking dumbass. We got out, we accidentally locked the truck, and like the emergency button to unlock the truck was around the front facing the guy with the gun, so we couldn't get around to get the fucking rig open. And so we sat there, waited for the cops, all the stuff, blah, blah, blah. Anyways, they didn't handcuff him. He got on the stretcher. He was cool. And we were going to take him to the hospital, get him medically cleared. He was going to go to jail. And it was my first call with a new partner. And he's like, hey man, don't undo the seatbelts. And I just hear a click, click. And then I look up and he's just swinging right at me, dude. Punches me square in the face. And I'm just like, okay. And he looks at me again like, how come you didn't go down? And then dude hits me again. And I'm like, oh my God. And then dude, he starts winding up again. And I grab him by his hair, by his nappy fucking hair. And I yank him off the top of the stretcher. So he's like in the loading position on like the power cot. And so he's whatever, 3-4 feet in the air. And I grab him by his hair and throw him off the stretcher. And we start fucking fighting on the ground. And the last thing I remember as we're tussling is he's got me. I've got him by the hair and I've got his face on the concrete. We're both on the ground, and then I start seeing lasers swinging around me, and I'm like, well, I should let go. Because I don't want this. And so I let go of him. They just tased the piss out of him. And he's like, I don't want to go with you. I'm like, good. You don't want to go with me.
You're not going with me.
You just got 2 free shots on me. I'm good. So
I've been fortunate. I've been punched, but I've never been, it's never been to where I felt like I was threatened. I know that sounds stupid to have been punched, but I think like, I look at some people and I'm like, that person has no clue that they're punching me. Now, do I deserve to continue to get punched? No, but because what I'll do is I'll restrain them in some shape, and I've always said this, like I was working in the hospital not long ago, and I got double tapped in the nuts, and then I got kicked in the stomach by a restrained patient.
Oh no!
Yeah, so I did. So here's the story, real quick. So they called me and they're like, "Hey, can you come? This guy's a difficult stick." Sometimes nurses don't tell you the full story, like why they're a difficult stick. She said, "Yeah, he's a difficult stick. We just got to give him some, I don't know, whatever, antibiotics." And I was like, all right, I'll be there. Well, when I got there, there was no nurse. She must have been with another patient. And I was like, I'll just go in and see what's going on. And he's Spanish speaking. So I had already read his chart, but I guess I missed the part where it said that he was Spanish speaking only. So I go in and I said, hey, my name is, so-and-so, and I'm here to do such and such. And he goes, no response. He just kind of blankly stares at me, like almost like a dementia patient who's like super a TBI patient, like a super out of it TBI patient is just like staring at you. So I walk closer and I notice that he kind of looks like he might be from like Mexico or something, and I'm not trying to be racist. I'm just saying that's what he looked like. So I said, like, hola, ¿cómo estás? And I was like, my name is Aaron in Spanish, and I'm here to do such and such. No response. So I get a little bit closer, and I was like, do you need an interpreter? And I like pointed at the interpreter, and he doesn't respond again. Like he's not even really even looking at me. He's just kind of looking up. So I walk over to him, and I said, I'm just gonna look at your arm, okay? And I pull the sheet back, and BAP! He's got the restraint on, but it's loose enough that he can. Yeah, pop like that. And I was like, you son of a bitch. And he did it again, and I grabbed his hand, and I'm holding it. I was like, stop fucking doing that, dude. That shit. Well, it hit. So I said, I thinking to myself, like, I can control his hand now. Now that I know this is a problem, it's actually beneficial that he's in these twice as toughs. Because what I can do is I can just kind of remove the strap and tie it down farther. And I can start the IV by having control of his arm. And I'll be out of harm's way and he can't punch me. In an attempt to move something, he did something else, and I was like, you know what, man, I should just call somebody else in just in case something, because I was getting pissed now, you know, I was getting punched twice, I was a little angry with this guy, and I have a short temper, and I don't want to punch this, like, old 72-year-old Mexican man in the face for something that he has no idea what he's doing. So the shift coordinator came down, and I was waiting on her to get there, so I picked up all my supplies, and I set them on the foot of the bed. He was covered up with a blanket. Boom! Right in the stomach.
Dude.
And I lifted up the sheets, and sure enough, they had removed the twice as toughs on his feet. But you're not supposed to do that. I just didn't know that. So I got kicked. But that's not his fault, right? Like, I blame myself for being stupid enough to get that close to a patient and not realize to what I was walking into. I should have, you know what I mean? Like, I should have looked. Or done a better job evaluating the situation. I don't think he was maliciously, although he did call me a fucking asshole later, I don't think that he was maliciously, well, I take it back. He maliciously fucking hit me, that guy. Yeah. Yeah, I mean, the more that I think about it, I think that he was just kind of being an asshole. I don't think he was doing it to me personally. Does that make sense?
Yeah.
Oh, yeah. Just, he would have done it to anybody.
Yeah.
Yeah, he's lashing out in frustration from being in the cuffs and being or not the cuffs, but the twice as toughs. And out of control and using the only control that he thought he had.
Yeah.
Yeah.
Nice.
So.
Well, dude, I appreciate your time, man. We're going to wrap this up, dude. I'd like to do it again. We'll get some more comments and topics, and we'll do a very in-depth deep dive on some actual critical care, actual treatment stuff. That would be fun.
Oh, God. You guys are going to try to make me look stupid. You sure you don't work with the Church of Evidence-Based Medicine?
No, man. We'll handle all the stupid for you. Yeah, don't worry.
We'll look plenty stupid for you.
We'll get it.
Yeah.
Do you want me to bring the other half of my co-host on?
Dude, that would be greit. Yeah. Yeah, let's do a giant round table. We'll do it. We'll start it off with mitochondria is the powerhouse of the cell, and then you guys can take over, because that's where it ends.
Yeah,
that's your extent of your knowledge. Yeah, I won't.
That's it. That's it right there.
Yeah, well, we're not. We don't consider ourselves foam per se. We consider ourselves like an educational platform for all types of learners. Right?
Yeah.
I know I'm just being cheesy as fuck here. But the point is I'm not going to push education. I think that's something that your command should do. But I certainly will push for discussion and dialogue. And I know it's uncomfortable for a lot of people. That's okay. It's uncomfortable for me, trust me. When you get lashed out at, like, pretty routinely and, like, called names and everybody fucking hates you, that sucks. Especially when you think you're trying to do a service. When you're trying to help people.
Yep.
Yeah. So,
but anyway, cool, I'll go. I appreciate you guys.
Yeah, man, for sure. We'll do it again. I appreciate your time, man.
Yeah. Thanks for coming.